I'm Noelle Bennett. I'm the clinical charge radiation therapist here at Dunedin Oncology. I'm also Allied Health Director for the Medical Directorate. And we're here today to talk about a trial we've just completed, which has had some very exciting outcomes for our patients.
I'm Annie Sutherland and I'm a radiation therapist here, a specialist radiation therapist at Dunedin Oncology.
I'm Melissa Bell. I'm currently the principal at St Hilda's here in Dunedin. And last year in March I was diagnosed with breast cancer, so I have just at the end stages of my treatment for that now.
We're talking about a new dressing for patients who are undergoing treatment for breast cancer. We've had for a long time quite severe what we call skin toxicities, in other words reactions to the treatment for these patients. The treatment works in such a way that it makes the skin go pink and quite angry, and it can go beyond that. It can get to a condition where the skin starts to peel, or even if it gets to its fullest extent, the skin can start to break down and it goes all wet and nasty looking. And we have just accepted that as, that's just one of those things that happens with treatment.
The research I did kind of talked about a lot of women having quite bad skin irritation, and that was kind of exacerbated by friction then with clothing, and that could lead to quite serious infection. So a lot of women document being unable to wear normal clothes and live a normal life.
We see patients going through breast treatments, men and women, and varying degrees of skin reactions or skin toxicities, and this could be slightly pink skin, it could be quite brisk red skin, irritated, itchy, discomfort, and also you can see sometimes the skin will break down, and that is messy, wet, very uncomfortable, very painful.
But then Annie and myself, who started dealing with these patients, were going, so why does it have to happen? Does it have to be like this? And we looked at what we actually did, at the care we gave, and the standard of care at that time was a cream called aqueous cream.
I believe before the trial of the film that most women just use an aqueous cream for a time leading up to their treatment, during the treatment and afterwards.
And so then the question came up again of, so why do we use aqueous cream? And the best answer we could come up with was, well, because we always have. So why did we start using aqueous cream? And we could find absolutely no evidence for using aqueous cream, other than the fact it was a moisturiser, so it made the skin feel good in the first place. But then once a reaction started, it just didn't stop it.
So we thought there's got to be a better way.
And we started looking around, and we happened on a dressing that we thought could possibly have some potential. When we originally wanted to start doing these skin trials, obviously we had no knowledge of how to do them at all, because as radiation therapists it's not something we do. So we were a bit groundbreaking with that as well. We were the first place to actually go into the thoughts of doing a clinical trial. So we contacted the School of Radiation Therapy at the University of Otago to ask if they could help, and they have this wonderful person called Patrice Hurst, who is so enthusiastic and was fabulous for us. So she bounced onto the scene and helped us work up the trials. And so it was probably May 2012, I would think, that Meptel film was brought out, and we got our first piece, and we were given one piece to test.
I was really lucky to be part of the film trial. It meant I was covered in film for the duration of my treatment. But for me, I had none of the symptoms that I had read about, so it greatly improved my quality of life during and I guess after the treatment process.
The real good thing with Meptel film is clear. It looks like a piece of glad wrap, and it will fit around compound curves.
I didn't know what it was going to be like to have the film, but I have to say within a day you didn't even know you were wearing it, so it was just very easy to get on with my everyday life, so I was very grateful to have access to the film.
Absolutely blown away by the results. We trialled it on 78 patients, and we found the results showed that it reduced the severity of the side effects by 92%, which is phenomenal stuff.
For me, I was able to, go running again, normal clothes, back to work. So, it was great for quality of life.
I would say, as far as the patient's concerned, one of the big things when these patients come to us, quite often they've had chemo before they come, they've all tended to have surgery, they've gone through a lot of trauma. They've had a lot of things that make them uncomfortable, sort of feel unwell. The benefit of this is we can get them through radiotherapy without them having to have any more of that. We can give them their lives back. It's huge.
Patients really like it because you can't really see it. You can see it like you would sort of another type of standard dressing, in that it's a bit shiny on the skin. After the initial day, they become unaware that it's on their skin at all, which means they can go to work, they can play sport, they can do all the things they would normally do in their day-to-days. It doesn't affect anything at all.
With the film, the other thing that was critical was it took so little time. So, it only needed replaced for me once a fortnight, if that, and I'd come in and see Annie and, 5-10 minutes later I was good to go for the next fortnight.
It's the best thing for patient care that, we could have hoped for. It's just amazing.
Every woman should have access to it. I think it's vital.
We will probably shift the focus from breast patients, because this is going to be our standard of care for now, and maybe look at helping prostate patients.
Look, my treatment has been fantastic and I have great confidence in my oncology team. Incredible nurses and specialists. It's been fantastic. I couldn't have asked for more, and incredibly reassuring at quite a stressful and difficult time.